Hello, I'm Jon Salmanton-Garcia from the University Hospital of Cologne. I work as a postdoctoral researcher and I do research in fungal infections, also in COVID-19 in hematological malignancy patients, and also in vaccine development. First, we have to say that both Molnupiravir and Nirmatrelvir ritonavir are very similar drugs in the sense that both of them are antivirals and also they can be taken orally, which means that we don't really need that the patient is in the hospital to get the drug. Having said that, they work differently the relationship with the virus, it's completely different. Molnupiravir interacts and makes mutations in the virus, while Nirmatrelvir ritonavir makes or interacts with the protease. The difference, and one of the pros of Molnupiravir over Nirmatrelvir ritonavir, is that no contraindication has been reported from the administration of Molnupiravir, and the same thing it happens in favor of Molnupiravir regarding drug-drug interactions. So when we are using Molnupiravir, we can be, so to say, more free regarding the type of patients we are giving it to. And this is relevant, for example, for renal dysfunction patients or for patients receiving immunosuppressive therapy. Well, there are many different limitations and we have to keep in mind different aspects. First of all, we need to consider that the patients with hematological malignancies might be receiving a treatment before even getting a COVID-19 episode. And thus, we cannot really use all the armamentarium available for COVID-19. Having said that, we need to consider also that not all the drugs targeted for SARS-CoV-2, they are not all the same, and depending on the variant affecting our patient, one drug might be useful, whereas another one no. So even if we have monoclonal antibodies and antivirals that are targeted for SARS-CoV-2, not all of them are equally useful for the patient. So we really need to evaluate each of the patients individually. We are part and we coordinate the ECCMID registry. ECCMID is an online registry for patients with an active malignancy within the last 5 years before COVID-19 that are adults and that have a laboratory-based diagnosis of SARS-CoV-2 infection. It can be either a PCR or an antigen test. We do time to time different publications on different topics, and this time we did a comparison between the administration of Molnupiravir versus the administration of Nirmatrelvir ritonavir. Basically what we did was that we extracted all the patients with monotherapy with one or the other drug. We made a match pair analysis, matching them by sex, age and disease or the malignancy severity, and we compared them in two aspects. The first one, the hospital admission, and the second one, the mortality, in different time points, day 30, 60 and 90 since COVID-19 diagnosis, and also on the last day of follow-up. Basically, we wanted to compare how was the hospital admission and the survival depending on the drug that the patients were receiving, and we succeeded in the sense that we wanted to show that there was no difference regardless of the drug the patient was receiving. We could see that there was no statistically significant difference regarding hospital admission or even ICU admission depending on the drug with a proportion comparison, and we did a Cox regression analysis and also a Kaplan-Meier survival plot in order to make it more graphical, and we could see that there were no differences on the different time points, day 30, 60 and 90 after COVID-19 diagnosis, and then the last day of follow-up. In our opinion, these data are very relevant. We did it with European patients, and basically the main or one of the big differences between Molnupiravir and Nirmatrelvir ritonavir is that Molnupiravir is not authorized in Europe. So in our opinion, we think that these results might help getting Molnupiravir authorized by the European Medicament Agency.